This is Leslie. She's a 6-year-old little girl. Ever since Leslie was a baby, she had difficulty sleeping. At the age of 6, Leslie was seen by a doctor for her irritability, oppositional behavior, and tantrums that lasted for hours some days. Her parents have tried every approach they have read about, as well as the advice recommended by Leslie's pediatrician in order to deal with Leslie's behavior. However, they have had no success, and there has been no improvement in Leslie's tantrum. With Leslie's meltdowns occurring every day, her parents find it very hard to get through the day. Her parents have found that Leslie can control her meltdowns when at school, with her friends, or if they are out in public. The triggers in which cause her tantrums are things such as clothing, touch, getting her hair or nails cut, minor things that cause frustration, changes in routine, and any perceived criticism. Leslie is an active girl and a thrill seeker. She is often preoccupied with spinning around and doing somersaults. Leslie often becomes overly excited during and after any movement activity. Leslie's moods often rapidly change from expansive to rage and tearfulness. She often suffers from feelings of self-loathing and feelings of guilt. But for the most part, she blames others or circumstances for setting her off. On Leslie's mother's side, there is a family history of childhood sleep disorders, anxiety, and a relative with symptoms of bipolar disorder. So what are the interventions? From a biological lens, Leslie would be assessed to see the activation of her amygdala when presented different situations. These can be things that she likes, like twirling or doing somersaults, or situations she dislikes, like clothing or getting her hair or nails cut. This is important because she is known to blame others for her outbursts. The assessment of the brain would show whether it is social or in fact biological. It is also important to check to see if the amygdala is damaged in any way, because this leads to problems in judgment making. Also because there is a chance that she may have bipolar disorder. It may be important to check her cortisol levels. Cortisol is what helps an individual to organize their thoughts during a stressful activity. This means that if she is assessed and shows to have low levels of cortisol, this tells that she indeed has trouble with regulating her emotions and making the right choice on how to react. There are many things that a psychologist could do in order to help understand and stop her emotions being dysregulated. A psychologist could be beneficial to Leslie as they could gain new knowledge through analyzing empirical methods to understand pivotal moments and triggers of Leslie's dysregulated emotions. In a school setting, a psychologist could use the help of art, play, and music to help Leslie explain what makes her frustrated, excited, happy, or sad. Since Leslie is only 6 years of age, psychologists would most likely perform a play-based or role-playing approach in order for them to gain helpful information from Leslie about her feelings and emotions. The psychologist would provide the results of any test they provided Leslie with to the other team members in order for them to join together and come up with the next steps. Sociologists would begin by determining which culture Leslie is from to fully understand her cultural influences and expectations. Given her parents' active involvement in seeking treatment for Leslie, one can assume she is from a Western culture. Given this perspective, the sociologist would work with the pediatrician and psychologist to develop a structured transdisciplinary intervention that would best fit Leslie's social and cultural needs. By educating her surrounding population, it would reduce the stigma, and as a result, Leslie's social environment would be more knowledgeable and flexible to her needs as she moves through her intervention process. This would allow Leslie to receive adequate social support in her cultural environment without compromising her emotional needs.